Friends, let's see what is the reason why finally in the 20 days more than deaths are recorded and more than 40,000 patients are infected because of this COVID-19 or novel coronavirus. In fact, this infection started at the beginning of the December 2019, but 80% cases are mild. It means there is a fever and a cough only, while 20% cases are the severe. On 23rd December 2019, first case of this COVID-19 admitted in the hospital. In the last week of the December 2019, one of the Chinese doctors informed their colleague about this new coronavirus disease transmissions among the patients. On 31st December 2019, World Health Organization announced that there is an outbreak of the new kind of the viruses. Chinese government still take the time, and on 7th Jan 2020, Chinese government announced that there is an outbreak of this novel coronavirus. So let's see the things now retrospectively. What happened exactly here? Infection started at the December beginning and outbreak was announced by the China 7th January. So in this long time frame and 1 month and 1 week, lot of people are infected. So they act as a source of the infections to the other community members. As the reasons, there is a lot of source of infections available. Second point, World Health Organization announced this is the global emergency. It is a learning lesson for the globe about any prospective outbreak will happen in the world. Source of infections, whether it is from the animal, whether it is from the reptile, whether it is from the birds, is not yet known to the world. So until the source of the virus is not yet being confirmed, it is challenging to control the outbreak. Like in the MERS, Middle East Respiratory Syndrome, we can say camel is the source of the infection. In the SARS in 2003, we can say Wuhan cat is the source of the infections. But for this novel coronavirus, COVID-19, we don't know the source of infection. Number 3, no effective treatment is available. It is said that vaccines are developed, but it will take around 1 year to be available to the global populations and to be implemented effectively after the lot of research study. So almost 1 year there is no any vaccines will be available. No specific treatment for the viruses, because viruses are making the genetic mutations. So though you find any treatment for one kind of the virus, after a few years or even after the few months, that same virus changes the mutation, it develops new forms. So there is no any specific treatment is available. Number 4, being a number of cases are increased a lot, at the same time there is a lack of resources available for these number of cases are increasing. And that's the reason it is more challenging to treat the increase of number of patients at the same times. Hospital acquired infection may case mild and admitted in the hospital, but hospital acquired infections are more common, and these hospital acquired infections can cause the severe infections among the other patients who are admitted. So unless until infection prevention and control not implemented effectively and strategically, number of cases will be increasing or the death will increasing in the hospitals. So these are the few reasons why number of cases are increasing because of this COVID-19 virus. And if we have to control the outbreak, we should identify source of infection from which animal it is coming. We should detect and declare the outbreak early. We should implement all accessibilities for these treatments, number of healthcare workers, number of hospitals required for increasing number of patients, and hospital infection control and prevention should be more strengthened. If we follow these, number of cases will be decreased. And most importantly, we have to wait until the vaccines is developed so that this kind of the virus can be under controls. If you like this video, kindly forward others, share with others and subscribe. Thank you for listening.